You want to stick a needle in my tennis elbow? Ouch, yes. Sticking a needle in the tender bit on your elbow, tennis elbow being here, yeah, this can be sort of some of the treatments that are offered, and it's not one needle. Obviously you've got things like dry needling, acupuncture, and even injections that go into there as well, including corticosteroid or steroid injections as well. Now in this research here, we're going to look at a comparison on the effectiveness of tennis elbow treatments, comparing sticking two different types of needle in. One is dry needling, which is basically acupuncture but done in non-meridians, so obviously sticking it directly into the tendon versus the actual meridian points that acupuncture commonly uses, and comparing that to a corticosteroid injection injected into the tendon. So this was a prospective randomized control study. And in this study, there were 108 people who suffered with tennis elbow that didn't get relieved by 3 weeks of first line interventions. There were 54 people in each group, and the minimum follow-up duration was 6 months. So they used the patient-rated tennis elbow evaluation. This was scored before, at 3 weeks, and also at 6 months after treatment. Now 7 patients were actually excluded for various reasons, so there were 101 finally evaluated. Now both treatments at the end were effective, we have to say this, obviously by 6 months. But actually the dry needling group were actually better with their patient-rated tennis elbow evaluation scores. Now there was a dropout on this as well. So we had more of a dropout from the corticosteroid group than we did from the dry needling group. The dry needling group, someone dropped out because basically they didn't like the pain that it gave them as an after effect. And from the corticosteroid group, 4 people dropped out because of skin atrophy and whitening effect. So overall, dry needling into the tennis elbow tendon, the common extensor tendon, looks to be a viable treatment, certainly for this phase of time. Now both were effective in the time frame given, meaning 6 months, but we do know of previous research on corticosteroid where over a longer period, like a year or so, it may actually have some adverse effects. And we saw some obviously acute adverse effects here in 4 of the individuals who dropped out because of that. So we have to take this time frame slightly into consideration, but certainly out of the 2 here, it would appear that sticking needles into an elbow does help, and certainly dry needling or acupuncture into that area would be a potential viable prospect. Now we have to say, of course, this shouldn't be used in isolation. It is an adjunct to loading the tendon, building that tendon up, looking at variables around the tendon as well, and trying to sort out the underlying reasons for the problem. So yeah, in my opinion, I think, needling, it can be an option. Not always, but it can be, as in dry needling. But I would say that corticosteroid, I would probably personally try and steer away from that if possible. However, there is always a caveat, and that is if pain is agonizing and rehab is almost impossible to come by, and you've tried other modalities and you can't drop that pain, then maybe as a one-off short-term intervention, corticosteroid may enable that. Exercises can be progressed, and then boom, you're on progress and you get into where you need to be. Well, obviously we do know that corticosteroid has degenerative effects. It's not great for the tendon in the longer term, so it should be taken not lightly and certainly considered as the value behind that. So, but overall, it looks like dry needling or acupuncture into the actual tendon itself may be a good idea for tennis elbow. So anyway, that's it for this video, and I'll see you next time.